Okay, these are the principles that for the health of nations. So you see them: religious freedom, marriage, children and family, sanctity of life, justice for the poor, human rights, peace, and care of creation. And from your earlier comments, you see that most all these areas have something to do with health in one way or another. All right, none of us probably are strong enough or rich enough or powerful enough to get much done on our own. That's why working together in coalitions is important. So the CCIA is an important venue, accord, interaction, and there's many, of course, many coalitions on health. The key issues, as I see from having worked at quite a few coalitions, is clarifying the basis for cooperation. What are the fundamental things we agree on, and then agree to leave all of our disagreements at the door. Very important, and we don't bring issues. For example, we had a refugee coalition once, and we had some Jewish and Muslim groups who wanted to start talking about the Middle East, and thought, okay, well, this is not going to be helpful for our coalition. So there are other places where those issues are talked about. So, do that outside, and then when we come together, we talk about things that we agree on. And coalitions are built on give and take, which means that you have to be prepared to give as well as to take. And have clear agreements on how you approve things, otherwise sometimes you get in trouble if you don't. Advocacy campaigns are also important, and I think they need to be carefully focused, usually time limited, using both earned and paid media and adequately supported. It's not easy to do, and we'll talk more about that if you want during the discussion. And then, some are dealing with grassroots, and I think that what I'd like to emphasize there is we need to come up with entry-level responses for people, so that if you meet people, this is the first time they heard the words of maternal mortality, you're not going to get them to, write a book on the subject, but you need to get what's the first step that they can take and make that very clear for them. And educate as you mobilize. Don't exaggerate. That's the one thing that turns me off, I think, more than anything almost, is that people making exaggerated claims. It happens at church all the time. And then to build over time. So if you work patiently with people, you can cultivate advocates. And as you advocate patiently, you can get results. And working with grass tops, this is local community leaders. The key that we can do there is to provide tools for them to engage their members. We don't want them just to become advocates, but alienated from their congregations or communities, but rather, how do we help them to bring their communities along with them? And we focus, since we can't deal with everyone, focus on those who share our passions, and we educate. And that's it. So I'll let Adam talk, and then we'll have a discussion.